Now, for the next emergency, that's pediatric emergency, which we'll be looking at, we look at what is known as a high riding testis. High riding testis. Okay, so I remember when they were teaching us about this, they call something like bell clapper syndrome. I'm yet to read that. Okay, it's usually associated with it. So it's actually a clinical finding. This is when the testicles, they lie abnormally high in the scrotum or even in the inguinal canal. Like the testis is not really resting in the scrotum, it's high up. Okay, so what are the common causes? It could be things like testicular torsion is the most common cause. So it could be that the spermatic cord has twisted on each other, thereby it is shortening, so it's making the testis kind of like come up. It could be undescended testes, that's cryptorchidism. So the testes are not descendant, you know. Okay, the testes are not descendant, so they actually left down. Then retractile testes, that one there is hyperactive cremasteric reflex. The testis is going up and down. Okay, then clinical significance is a child having a high riding testis will be having acute scrotal pains. Okay, other ones is horizontal lie of the testes, absent cremasteric reflex, then severe scrotal pains, then nausea and vomiting. Okay, so diagnosis is a clinical examination. You get to see that the testis is highly positioned, you know, abnormal lie, tender testes. Yeah, you can also do ultrasound. Okay, do not delay surgery if it is testicular torsion. Okay, you don't want testis tissues to actually die off. Okay, so management is undescended testes, retractile testes. Testicular torsions, they actually do surgeries. Undescended testes, they do what? Orchidopexy. Then retractile testes, they can just observe. Okay, because the testis is going up and going down, so you can just observe for the time being. Okay, so that's what we got for high